Where's my baby?
I'm Dana Denha.
And I'm Melissa Bondi, and this is Adventures in Parenthood. Throughout this series, we will explore the world of raising kids all the way from newborns to adulthood.
Being a new mom is hard. There's no ifs, ands, or buts about it. You can read book after book, but you won't really know what you're in for until you're in the thick of it. More and more of us are giving breastfeeding a try, and it's what's best for the baby. But that comes with its own set of challenges. And without the proper support and education, it can be a daunting task. So, Melissa, you actually did give breastfeeding a whirl, but you were never really able to feed from the breast. Is that true?
First couple months, and then I consider myself an exclusive pumper after that. So going all the way to about 7 months, I think. And then I went into that phase where she wasn't wanting it as much, so we both phased out together. But I know you're still in it.
Yeah.
So yeah, totally different situations, and we're going to talk about that today.
Yeah, I mean, I kind of, I didn't pump at the beginning because I took a breastfeeding class with St. Joe's, and the lady was telling us that it's best to try not to pump at least for the first 3 weeks. So I was like, good, I don't want to pump anyway. Right. So I didn't pump for a little while, and then I started to, but I never got as much from the pump as she was able to get from the breast. And I also find that just picking up a baby and putting her on your breast is a lot easier than having to get the milk out with a machine.
Right.
So that was like a big thing for me. But I mean, also one of the big problems I had, I think, when she was little was, they give you like time frames of like, okay, your baby needs to eat every 2 hours. And I think some people like really stick to that time frame, but my problem was my baby wanted to eat probably every 45 minutes. So I was just like, I was just breastfeeding all the time.
Right.
I don't know if that was normal or like it was a comfort thing or she just needed it that often because she was only getting so much. I don't know. I don't know and maybe our guest later can fill us in on why that was happening for me, and I just went along with it. I was like, whatever the baby needs. Whatever was going to make her stop crying, I think, at that point, because she did cry a lot when she was.
And you knew that would soothe her.
Yes, I knew like the breast would soothe her.
And it's not, I'm going to go out on a limb and say that by any means, that's not. You did no harm by doing that. When she wanted it, you gave it, and that was okay to do. No one's going to probably tell you differently on that.
Yeah.
But yeah, definitely. As far as pumping, I don't have it. I did it, and it worked for X amount of months, and I just got used to it. It was not the most fun thing in the world, but. I did it because I thought that was best, and it worked for us. So,
what made you not want to do straight breast after just a couple months?
She wasn't. It was a weight thing. It was a weight. Doctor said, "All right, let's start formula and breast. Let's do both." And it was definitely a weight thing at first, and then it just evolved, and that's what it evolved to.
Yeah.
Yeah. So. But yeah, no regrets. It was fine. It worked, and everything's okay. So.
No, I mean I'm definitely under the no judgment category of this. I feel like, especially if you're a first-time mom, you can't judge anyone for anything because you're just trying to figure things out as you're going, and you might have some support from people that have done it before, but for the most part, you're alone. I mean, you're on maternity leave, and you're alone.
Literally, yes, I know, because we are working husbands.
Yes, so. And you need to figure out what's going to work for you in that situation.
Exactly.
So,
okay, well, awesome. That was all right. Okay, so let's talk to our guest today. Joining us is St. Joe's doctor that knows firsthand how to make breastfeeding a success. She is a fellow of the Academy of Breastfeeding Medicine and a breastfeeding medicine physician, consulting moms and babies with a number of breastfeeding concerns. Welcome, Dr. Lisa Hammer, MD, to the show. Welcome.
Thanks for being here, Lisa.
Yeah, thanks for coming on.
Thank you.
We have a lot to talk about.
Yes, we do.
So why don't we first talk about your background and how you evolved from just being, you were a physician and then you started getting on the breastfeeding track.
So I am a board-certified pediatrician, and I'm also a board-certified lactation consultant, which makes me able to address breastfeeding concerns from a medical perspective. I first got interested in breastfeeding when I was pregnant with my first child. I was at the end of my medical training, so I'd been through undergraduate medical school, pediatric residency, had been pregnant for 9 months, learned everything I thought I could know about pregnancy, and realized I knew almost nothing about breastfeeding, and was kind of shocked that I could be all the way through my medical training and be unprepared to breastfeed my own child. So I spent a month working with a team of lactation consultants, and that's where I got my initial interest in lactation. Then, of course, I had my own child and breastfed, and then over the last 18 years have been gaining increasing knowledge in breastfeeding, and had a general pediatric practice for about 15 years in which I incorporated breastfeeding principles, and then have gradually been increasing the percentage of time I spent specifically doing breastfeeding consultations, and now that's exclusively what I do is breastfeeding medicine.
And can you explain what breastfeeding medicine is?
Yes, so that's a term most people haven't heard. Basically, it's a growing field. I am a member of I am a fellow of the Academy of Breastfeeding Medicine, which is a physician organization of physicians who focus on breastfeeding. We have about 500 members worldwide, so it's a growing group. We are able to see mothers and babies together in an office-based visit. As physicians, we're able to bill insurance, so it usually is covered by a family's insurance. They would just have their copay typically. And we can address any level of breastfeeding concern in a medically relevant way. So we bring mom and baby both in for a visit. We get a full medical history, do a medical exam on mom and baby. We usually observe a breastfeeding session, assist with that. We weigh the baby before and after the baby feeds, so we know how much the baby's taking at breast, and then help mom develop a comprehensive feeding plan that addresses any medical concerns she might have. We see everything from just basic reassurance for normal breastfeeding to maybe sore nipples and helping assist with latching. We see moms that may have breast infections or concerns about breast infections, pain in the breast. We see babies who may not be gaining weight, babies who may have a history of something like prematurity, who have particular breastfeeding issues. So we see a real wide range, and we see everyone, even prenatally, will meet with moms and consult about any concerns they have, certainly right after the newborn period, when breastfeeding is really trying to get established, but all the way up through weaning. Moms may have questions about pumping and return to work, or baby might be doing fine and then suddenly at 9 months isn't gaining weight well, mom's milk supply may have dropped, things like that. So a whole host of issues in both mom and baby are addressed.
Okay. So you're talking to two working moms who both went back to work and did the pump thing.
Yes.
And what advice or what would you say to those who are in or going to be in the same situation, who may be discouraged, thinking I have to go back to work, I think I'm going to give up, or I'm just going to move on. What would you say, or what advice?
I would say you can do it, but it's not easy. Get help, get support. This brings up an issue that I did want to address, which is that we're not going to spend a lot of time talking about the benefits of breastfeeding or the benefits of breast milk, because I feel like there's a lot of emphasis already placed on that, and I think women are getting that message and are hearing that. And I think most women do want what's best for their baby. And I feel like we're putting some pressure and expectations on moms to provide breast milk for their babies, but women are faced with many challenges, such as returning to work, and continuing to breastfeed after return to work is very, very hard. And I think that we, as a society, just expect moms to just know how to do it and be able to do it, and we're not providing them with enough support and help to make it successful. There needs to be support in the workplace from bosses and colleagues and coworkers, and a place to pump. There needs to be support from your physician or your pediatrician who can help make sure the baby's gaining weight, and potentially support from someone like myself or a clinic like ours that can help mom figure out how to have a pumping schedule and when to pump and how to maintain her supply. So one of my goals is to try to make sure moms feel adequately supported and that they're not doing this alone, and this is a team approach to this, so they can feel that they're successful.
I will say that I think we can both attest to the fact that CTN here was great about being supportive, about they gave us an office to pump in, and we could pump whenever we needed to. So I will commend this place alone just for doing that for us, because I know that can be a big challenge in itself. But yeah, we were talking before the show, and one of my big problems was that I just never got enough when I pumped. I think I built up a supply to last so long after I got back to work, but then I ended up having to supplement, and it was also because I didn't realize that the support kept going for breastfeeding. So was there something I should have been doing maybe that would have helped me get more milk for my baby from the pump?
Well, it's hard to know in your situation about all the details, but you want to make sure your pump flanges are fitting appropriately, aren't too small, for example. You want to also make sure that your pump settings are being used appropriately, or adequate suction. You want to ideally be in an environment where you can relax so that you have an adequate letdown while you're pumping. Sometimes massaging your breast before or during pumping can help with that. Also, timing of pumping can be a factor. You need to be pumping ideally every 3 hours or so to maintain your supply. Another factor that can happen is sometimes if you're back to work and the baby's a little bit older, maybe start sleeping through the night. So you're going kind of long periods overnight without pumping, and then maybe not pumping as much during the daytime hours because you're away at work, your supply can really start to go down. So there's a lot of areas where getting some help might be able to, turn that around, and you might be able to get your supply back up even with pumping.
Now, how can people, if they are interested, moms and dads, for the educational part of it, if they want to receive your help, or where would you guide them, or where would you tell them to go?
So our practice is called IHA Breastfeeding Medicine Specialists, and we're located at the IHA building at the Domino's Farms location. Okay. We're pretty easy to find online, phone call. Okay. There's other options as well. If it's more not so complicated, La Leche League is very active in Ann Arbor, and you can just reach out, phone call to another breastfeeding mom. That might be appropriate or might be enough. University of Michigan does have outpatient lactation support as well. And then there's some private lactation consultants in the community that you could reach out to also.
Okay. I will do a callback from when I was talking at the beginning about how I mentioned when she first came home and I was breastfeeding her. That was probably the first few months, every 45 minutes. Is that a normal thing that happens to people?
It can be.
Yeah.
And I agree with what you said in terms of, you can read about breastfeeding and the textbooks say, breastfeed every 2 hours for 20 minutes each side, and there's all this, and I do this all day, every day, and I've never seen a baby that breastfeeds 20 minutes every 2 hours. It's just every baby's different, every mother's different, every milk supply is different. And so you really need to tailor it to the individual situation. And like I said, there's not a right and a wrong with breastfeeding. If the baby's feeding every 45 minutes or feeding every 5 hours and gaining weight, then it's fine. But if the baby's not gaining weight, then that's an indicator that.
But I'm glad to hear that, because I feel like everyone I know that has breastfed always sticks to this, like, you really only need to feed the baby every 2 hours. So, and I know my sister personally was doing that, and her son wasn't gaining weight. And I know, like she said, if she has another baby in the future, she was like, I think I'll just do what you did. If the baby's acting hungry or fussy, then feed the baby. Like it's not that scientific. There can't be this formula to it.
Right. And so breastfeeding really frequently or breastfeeding, far apart are indicators that something could be wrong and that you want to get that assessed.
Yeah.
And then, like you said, if the baby's not gaining weight, then it may need to be addressed. Another thing that comes up very, very frequently is sore nipples. And does sore nipples mean the baby's not latching right? It might mean that, it might not mean that, but it warrants getting it addressed. Studies show that about 85% of women experience sore nipples in the first week of breastfeeding. So we don't want to say breastfeeding shouldn't hurt, because it does a lot of times, but the pain should be gone by about 2 weeks.
Yeah.
So if you have really severe pain in the first week, or pain that's not going away, that's something to get addressed and get help with.
I think it was, I was told numerous times, you just got to get to the first week. Just get to the first week, and you can do it. And I thought, and that was in my head, and it worked. And I thought, okay, weekend, and then it went away. It went away.
I think
it's
the
just
other
a matter
thing
of
was,
it's like willpower.
I think I was under the impression at the beginning, like, oh, well, at the very beginning, my nipples didn't hurt because we had just started and it wasn't,
Fine.
she hadn't been doing it enough yet, and it was like I wasn't putting any nipple cream on to, like, stop it from happening before it happened. And I think that was my mistake. I think that would have been actually helpful to me to start using, like, lanolin or something
Preventatively.
befon the pain started.
Yeah, I think I had that prepped in the hospital, and I was like, I'm ready for it. I'm ready for whatever comes. I'm going to be ready. And I was, and it worked.
I think
But
to your point of saying, I just willpower and getting through it, I think what happens as a new parent in that first week when things are so difficult and so painful is you just think this is the way it's going to be for the next year, and it's usually not.
It's not.
Yeah.
I think we can both say it's not.
It's better.
It does. It does get better.
Well, and so if we go further on, I have a 15-month-old, and she's still breastfeeding, and we talked about how weaning is also a challenge, and it becomes more challenging as they get older, because I know if I hold my baby, like, I'm going to get home from work at 4 o'clock, and she's going to want to come to me, and as soon as she comes to me, she's going to rub her face on my chest and whine until I give her breast milk. And I'm not saying I need to wean her right now, but I, like, just the fact that she's like that is giving me the indication that I'm not going to have an easy time weaning my baby.
Yes, and it's also probably an indication that she may not be ready, and maybe you may not be ready either. And so weaning, again, so breastfeeding involves a mom and a baby, and it's a relationship and an experience for both mom and baby. I find that I'm asked this question a lot: how long should I breastfeed? Should I breastfeed for 6 months? Should I breastfeed for a year? And we do have guidelines set forth by the American Academy of Pediatrics, which is exclusive breastfeeding through 6 months and then breastfeed through a year. However, most babies, if they breastfeed through the first year, are naturally going to continue. It's not that they're going to suddenly want to wean at a year. There's nothing about the year point. And the benefits of breastfeeding continue well past that point. So, certainly continue breastfeeding till you feel ready to wean, till you're ready for baby to wean, and then weaning often is an active process, and it can be very intimidating, but it can be something that you can work through with your child in a loving way, just like any other life transition that they're going to go through, like sending them off to preschool or kindergarten or college someday. But that's something that I'll also see moms about in the office, and we'll talk through their particular situation and what weaning strategy might work for them.
I'll be making an appointment at some point. But I think that's the other thing is, I think that people that never breastfed, like, for instance, my own mom, it's like it's simple. Like, I don't get a lot of sleep at night because she still wakes up to breastfeed, and it's like, just stop breastfeeding her. And I feel like that's like the kind of the answer you get from a lot of people that don't understand and have never been there before.
Right. And in this country, we don't have a breastfeeding as normal type of culture versus other parts of the world where breastfeeding through age 3 is very normal. And so we have work to do there.
All right, we're going to put you on hold for a second.
Okay.
And we're going to take a short break, and we'll be back to learn more about the challenges of motherhood and the reality of postpartum depression. We're back with Dr. Lisa Hammer, and she's going to tell us about some of the challenges associated with breastfeeding that can also sort of lead to postpartum depression as well. So what are some of the #1 challenges that you hear a lot about?
So in my practice now, I deal a lot with moms who are struggling with breastfeeding, because those are the patients, obviously, that make appointments and come see me. They're feeling a lot of pressure to breastfeed. They want what's best for their baby, and it's just not working out for whatever reason that may be. And it might be a baby issue, a premature baby who can't latch, a baby with some sort of oral motor dysfunction and can't latch. It might be a mom issue, a mom with prior breast surgery, maybe breast cancer or radiation or something wrong with her breasts. And so for any number of reasons, breastfeeding is not going the way she had hoped. And, as mothers, we have visions of what it's going to be like as a new mother, and most of us are planning to breastfeed, and then when it doesn't work out, it can be devastating for moms. And they feel a lot of pressure. They feel judged, maybe by family members, by friends, by, out in the community. And those are the mothers that I really hope to reach, and I hope to support. And I hope to reinforce to them that they are doing everything they can do, to help their babies. And that formula may be the very best choice for their baby at this point.
Right, and you're probably, and I'm going to limit and say that you're helping them not feel like they've failed at something.
Correct.
Between how they had the baby and between the breastfeed, how they're being fed, there's so much societal pressure, and I hate it, and it's just very frustrating. And I had to push it to the side when I started, and just white noise. You're going to do what's best, and I feel like that's, it sounds like your main goal,
right?
Yeah.
So and I tell these moms, babies that breastfeed well, it is easier. They come home and they breastfeed, and you just follow the baby's cues, and they feed and they gain weight, and we need to support those moms, and they're doing a great job. You're pumping every 2 hours. You're trying to keep your milk supply up. You're doing breastfeeding, pumping, bottle feeding. You're doing like triple the amount of work, and yet you're feeling like a failure. And really, you need the gold star. You're doing the extra work. You're going above and beyond to do what's best for your baby, and you deserve to be recognized for that. I feel like those moms tend to also be the ones that tend to end up isolating themselves more at home, because they don't necessarily want to go to the Leche League because everybody there is breastfeeding, or they don't want to go to the local mothers group because everybody there is breastfeeding. Right. And to go and bring a bottle-fed baby, it can just feel like another place where you're opening yourself up to be judged.
I know.
So they tend to isolate themselves more.
The first time I had to give my baby formula was devastating to me. I cried on the phone, and it's making me upset thinking about it now, because you really don't, you want to give them that breast milk, and I couldn't give it to her, and it makes me sad to think about it still, even though she had formula more than once. But
and I didn't feel that necessarily. I just, at the time, I was, this is, you're gonna get fed. I just didn't feel, so every mother is just so different.
Correct.
The judgment is just astonishing. I feel like there's so many support groups out there now that we can go to, that we don't have to. It's kind of like, well, it's okay, we're normal, it's okay. So, I just feel like we've come definitely full circle when it comes to that. And like you said, even going out in the public, like if I give my daughter a bottle, it's like, I've gotten to the point where it's like, I don't care. This is what makes her sleep 12 hours, she's going to have a bottle. It's one of those, you got to do what's best for you.
Do what's best, but a lot of mothers aren't feeling confident in that choice, and not feeling supported in that choice.
Is it the conversation that they need to have, or is there something within that they need to find? Is it the confidence? Or is it just natural for new moms to feel like that? That's what I guess.
I think it's natural. As new moms, we worry, and it's part of the role of being a mother. You worry, and you want what's best for your baby. And other people can tell you it's fine. And I find that dads always want to make things better, and they always want to tell them, it's fine, it's fine, just give formula, And I have to sort of stop the dads and say, I know that you want what's best, but you have to realize that mother has her own emotions, and this is a lot more emotional for her right now, and so we have to address her emotional needs. Right. And it's generally a real process and a real journey of coming to the place of realizing, within yourself what's best. And so a lot of moms will ask me, should I just stop? And And I really don't really say that to anyone. I really try hard to help coach them through their decision-making process and them reaching their place of saying, okay, you know, I've done everything, I've tried everything, you know, bottle feeding is going to be, you know, the way that we're going to go. And and I hope that by working through that journey and that process that they feel confident in their decision, that that was the right decision for them for X, Y, and Z reasons. It might not have been the decision they ultimately, or that they had hoped for, but that ultimately they feel supported in reaching that place, because this period of your life, you know, carries on for years ahead. I've had grandmothers come in with a newborn and their daughter and recount their breastfeeding experience from 30 years ago.
Do you find postpartum depression a trigger is time of year of having
Certainly
a baby?
it can be. It is harder, especially in Michigan. You're more isolated, especially in the winter. It's harder to get out.
Right.
So a little bit about postpartum depression. You know, we estimate now that about 1 in 7 women experience some sort of perinatal mood disorder, depression or anxiety around the time of childbirth. So it's very, very common. Most women talk about or have heard depression. They get asked, you know, are you depressed? Postpartum anxiety is very, very common, and we don't ask moms that. So I have a lot of moms who are really, really struggling emotionally, but they keep being asked, are you depressed? And they say, no, I'm not depressed, but they're not sleeping at night. They're very anxious. They've got obsessive thoughts. They're worried about the baby. And it might be actually anxiety. So, you know, worrying about the baby not gaining weight. Are they getting enough at breast? Maybe the baby isn't breastfeeding and they're grieving the loss of that breastfeeding experience they had hoped for. You know, all of these issues can be tied into a perinatal mood disorder. And so often we have to, you know, look at the full picture and help mom address that in a more significant way, either through some psychotherapy, social work support, sometimes medication, which often your OB provider can provide.
Is there some sort of signs that you would say just go seek medical help if you're feeling this way after? Because I feel like I've known people that have had postpartum depression and they waited a really long time before they got help because they didn't realize it.
If you're not enjoying the baby, if you're not feeling that bonding happening, if your emotions are getting in the way with daily activities, being able to care for the baby, you know, a lot of moms just think maybe this is normal, maybe this is how being a mom feels, right? And so they don't want to reach out.
Right.
But you really should, because there is help. Postpartum mood disorders are the most treatable form of mood disorders. They really respond well to medications, and even just short-term interventions, meeting with a social worker a few times to help you process through this can really change your postpartum experience and bring some joy back in.
So I was going to say, so the takeaway is that no one should feel as if they cannot get help, or you're not any less of a mom if you do seek and want to seek and think I need to see someone.
More of a mom.
Exactly.
Because you want to be the best mom possible.
Exactly.
And that's what kind of drew me into this field. As I was a pediatrician, I was treating babies, but I realized I'm only going to see the baby in the office for 10 minutes. These moms are really the ones out there caring for these babies. And if we want these babies to thrive, the moms have to be thriving. And I feel like we aren't supporting moms enough.
Right.
And that's why now I focus exclusively on this postpartum period and supporting moms through this challenging journey of parenthood.
Exactly.
Well, thank you so much, Lisa. We might have to have you come back at some point because I feel like we could talk about a lot more.
Yeah, this is wonderful. Exactly. This is a 2-hour show for sure. So thank you so much for coming on and talking with us.
You're welcome.
And again, if you have an idea for a parenting show or a topic or a guest, contact us at ctn@a2gov.org, or you can talk to us on Twitter at #CTNAnnArbor.
For more on programming and services available at CTN, visit a2gov.org/CTN. Thanks for joining us on this adventure in parenthood. Until next time.